Hi, I'm Dr. Judy Morgan, author and veterinarian. This is my book, From Needles to Natural. Today, I'd like to talk to you about senior pet care. Anyone who follows my Facebook page knows that I am a big proponent of taking care of our senior pets and not giving up on them too early. I've just adopted two 14-year-old Cocker Spaniels who were turned into a high-kill shelter when their pet owners died. And I think that's a travesty. So if you don't have anyone who can take care of your senior pets when you leave this world, please make sure that you've made arrangements for someone to take care of them. Many times our children do not want the responsibility of taking on our pets. Right now I have 7 horses, 4 cats, and 9 spaniels that are going to need to find homes if something happens to Hugh and I. My plan right now is to stick around for a long time, but you might want to think about that because you never know what could happen. So what special needs do our seniors have? To me, seniors are very special and we shouldn't give up on them. Just because it requires a little more care or a little more time or a little more money. When we take these pets on as cute little puppies and kittens, I think we take on the responsibility of caring for them until the end of their lives, and we want their lives to be happy and healthy for as long as possible. It's not about the quantity of life, it's about the quality of life. And you need to make sure that you are watching and being an advocate for a high quality life. There are a lot of veterinarians now who are specializing in hospice care and senior care, and I think that's an awesome thing. And knowing when the time has come to end a life or to let go can be a very, very difficult decision, and it's an individual thing for every person. I personally get upset when a pet is presented to me for euthanasia, and I think that they're not ready, and they have a lot of mental capacity that has a love for life, but they're dealing with some pain issues or some problems that the pet owners just don't want to deal with. So what kind of things do we start seeing in our seniors? A lot of pets will withdraw and they'll sleep more. And a lot of times we think that this increased sleeping is just because they're getting old. But very commonly, that increased sleeping, decreased interaction with people is because those pets are suffering with pain. It could be pain of arthritis, it could be pain of cancer, it could be pain of some disease that they're dealing with. So make sure that if your pet is not interacting as much as they used to, or they're withdrawing from the family, that you get them checked and make sure that there's nothing that needs to be treated and there's not pain that's being ignored. I had that problem with my older Doberman years and years ago. I thought he was just getting old. Then when Rimadyl came out, and believe me, I'm not advocating Rimadyl because I'm not a fan, but when it first came out, we thought it was a wonder drug. And when I gave it to my dog, oh my goodness, he became so active. He was chasing deer again. He was running with the kids. And I didn't realize that he was sleeping more because he had so much pain from arthritis. So if your pet's withdrawing, please get them checked and see if there's something going on. Other problems that we see in senior pets: decreased vision. So make sure that you watch your pets when they're outside. Don't send them out unattended if their vision is decreasing. If they're barking at people suddenly when people enter the room, maybe it's because they don't recognize them. They don't recognize people that they've known before. It's not that they're being overprotective or that they're getting mean. It's that maybe they can't see who's in their field of vision, and maybe they don't have any vision. And that might be something that could be helped with medication. So again, something to have checked. A lot of senior pets have decreased hearing, and so they might be barking more. Well, maybe it's because they can't hear anything. They don't know where they are. One of the senior cockers that we just took in, if she finds herself alone and she wanders around the house, she can't see and she can't hear, and when she can't find any of the other dogs or can't find people, she will start barking this horrible, lonely, I can't find anybody, and she gets panicked, and so she'll bark. So when I hear that bark, I know that she's gotten herself into a room that she can't find her way out of, and she can't find any of her friends. So sometimes increased barking can be a sign that there's something going on that needs to be addressed. Hearing loss can be difficult to repair, but if the pet has chronic ear infections or something, chronic swelling in the ears that could be treated, you might get some of that hearing back. So don't count them out, and don't get mad at them if they're changing their habits, because that's a common thing that happens with seniors. Senior pets can also get cognitive dysfunction or senility. Just like grandma and grandpa can't remember things like they used to, their short-term memory may not exist anymore. The same thing can happen with pets. I know as I'm getting older, I walk into a room and I can't remember why I'm there, and I have to retrace my steps 10 times to figure out what it was I was trying to find. Well, the same thing happens with our senior pets. And, sometimes they can't find their way to the door to ask to go outside. So if they're losing their house training, it may be because there's a problem. Urinary tract infections are much more common in senior pets. So urinating in the house, dribbling in their sleep, urinating big puddles in their sleep, seeming to lose their house training, commonly there's a problem there. They've got a urinary tract infection. They've got stones in their bladders or their kidneys, or they just can't find the door. So make sure that you have urine samples checked and have blood work done to see what the kidney function is. And don't be mean to your seniors. I have dogs in diapers, and that's because they leak urine. And until I get the problem solved using herbals and acupuncture or medications, then I'm going to use what I need to keep my house clean and to keep them clean. And that's another thing. Senior pets cannot keep themselves as clean, so it's up to you to do a better job grooming those old campers. And maybe pets with long hair need to be clipped down a little bit shorter, particularly in the hindquarters where they might be leaking urine or might have some stool accidents and they can't get that out of their hair anymore. And certainly we see, and this is gross, we see a lot more problems with maggots in older pets who are soiling themselves and the owners don't notice. So keep the coat clip short back there. Certainly we see cancers more often in older pets, so that's something else to watch for. My recommendation is that your senior pet sees the veterinarian at least twice a year for a full physical examination. I would love it if you would have blood work done on your senior pet to monitor kidney, liver, and endocrine functions. But if you can't afford that, at least have it done once a year and have that full physical exam. Pets age much more quickly than people, and as we age, we should see our physician for a routine checkup at least once a year, and our pets are aging much more quickly, so I would check them at least twice a year. Heart disease is certainly more common in older pets, so listening for murmurs, watching for any changes or symptoms, coughing, inability to get up the stairs, panting more, increased respiratory rates. Very, very important to be more vigilant with the seniors. Be very careful when they're out for walks, particularly on hot, humid days. They can't cool off as well as the younger pets can. They're going to have more trouble and be more susceptible to heat stroke. So my request, be kind to your seniors. I think they are so lovable and in my mind really more fun than puppies, because when I see these old guys run across the yard and wag their tail and do something that they haven't done for a long time, to me that's one of the most rewarding things about rescuing seniors. So hopefully this will help you know what is normal and not normal for your seniors. Please take care of them and take care of yourselves. If you want more information for diseases that senior pets can get, please get a copy of my book, From Needles to Natural. It's available on my website, www.drjudymorgan.com, and also on Amazon. Thanks for tuning in.